That's for her.
All right, so last lecture, we talked about different levels of consciousness. How many were there?
Four.
Four. Do you guys remember what those four were?
Alert, drowsy,
And then
Unconscious.
the last one, where they're not responding. Comatose. Yes. So, how do we check for levels of consciousness in a patient?
That is the blood pressure, or here's the pulse.
Yes. So, levels of consciousness. When they come in, the first thing that we do is ask them to state their name, their medical record number, their date of birth. If they're able to respond to you, listen to you, see you, that's called being alert and oriented. Okay? So alert, oriented, sometimes when the nurses call to give you handoff, like if they're sending a patient down and they call to tell you like how the patient's doing, they may use the term ANO times 4. So that means they're alert, oriented times 4. They're oriented to person, place, time, and event. Those 4 things. So they know who they are, they know where they are, they know what day and time it is, and they're aware of what's going on. So person, place, time, event.
That's the most alert?
Yes, ANO times 4. Sometimes they may say ANO times 3, ANO times 2 if they're kind of, confused or not sure what's happening.
You say ANO?
AO times 4. It's referred to as A and O. That just means alert oriented.
So person, place, and
Time, event. And of course, if you notice that there's any change in their levels of consciousness, you let somebody know, either a tech that's near you or call the patient's nurse. Okay. So, what is shock? This is the definition of shock: failure of the circulatory system to support vital body functions. So this is not the shock you experience when you open your checking account and see a negative balance.
That's a different shot.
This is a shock that happens internally to your circulatory system. And there's different types of shock, which we'll go over. 4 different kinds. Hypovolemic shock. That's the shock that happens when you have severe blood or fluid loss. Cardiogenic shock. Cardio has to do with the heart. And that's when the heart can pump enough blood to meet your body's demands. Neurogenic shock is caused by low blood pressure. What was the term for low blood pressure? Hypotension and slowed heart rate. Vasogenic shock is when your tissues are not getting enough perfusion. So basically they're not getting the nutrients and the oxygen that they need to function properly. And then anaphylactic shock is a type of vasogenic shock. So that would fall under this. And that is a severe allergic reaction. Most of the time it happens when there's a contrast reaction, like in CTs.
Is that common? Is that
Anaphylactic
common?
shock?
Yeah.
I've seen it happen maybe 2 or 3 times. Because there's so many precautions that are taken to make sure patients don't have a reaction.
Yeah.
So it does happen. Alright, common signs and symptoms of shock. If you notice that the patient is being restless, anxious, if they have tachycardia, what does that mean? Fast heart rate. Shock can happen from very low blood pressure. Like if a patient loses a lot of blood, they can have very low blood pressure, which can lead to shock. Another symptom is that they have very cold and clammy skin. Pallor, what does pallor mean? Sorry? shock. So like I said, it's a type of vasogenic shock. It's the most common type of shock encountered in medical imaging. Because it happens a lot in which department? CT. Of course, the most often thing that happens is contrast media reaction. And that's why whenever techs do CT scans, you know, they tell them ahead of time, you may feel hot, you may feel like you peed on yourself. Anything other than these, please let us know. Because we want to prevent the anaphylactic shock. If it does occur, some hospitals do have special teams that you call immediately. And there's also nurses that are within the department in case of an emergency like this. And you would also notify the radiologist. So anaphylactic shock may be mild or very severe. The mild would be urticaria, which stands for getting hives on your skin. And then the most severe would be death from cardiac arrest. I remember when I started working in CT at MD Anderson, there were stories going around that a patient, I think, came in for their first CT scan, and he was very overweight, so he had other underlying issues. So then, you know, when you introduce contrast into your veins, you're going to alter your heart rate and stuff like that. And unfortunately, that patient passed away. And it was their very first CT scan at MD Anderson. So just imagine.
Yours,
Huh?
is it yours?
No, it wasn't my patient. It was somebody else's.
So what was the severe reaction called? If urticaria is called,
So the
or that's mild, right?
So urticaria is hives, that's the mild side. And then the most severe is death from cardiac arrest.
Oh, so urticaria isn't the name of the mild term? It's just the hives?
It's just a type.
Okay.
Urticaria means hives.
Okay.
So these are some of the mild reactions from anaphylactic shock: itching, hives, nausea, and vomiting. Those are the mild ones. And make sure you understand these are reactions to the contrast. It's not a side effect. Side effect to contrast is that feeling of heat, feeling like the patient needs to pee. These are reactions, like allergic reaction to the contrast. And these are some of the more serious reaction. Laryngeal edema, that's when your larynx closes up and you're unable to breathe. Cardiogenic shock, leading to cardiac arrest. Do you guys remember what cardiogenic shock was? When your heart's unable to pump enough blood, can lead to cardiac arrest, which can lead to death. So in the case of cardiac arrest, what do we do? CPR. Alright, now we're going to talk about several different types of medical crisis. These are all the different types: diabetic crisis, respiratory distress, cardiac arrest, cerebrovascular accident, minor medical emergencies, and wounds. So we'll talk about each of those in detail. Diabetes. So a healthy patient, the body usually adjusts our own insulin production and excretion to meet the body's demands on the carbs that the body needs to function. But if a patient has hypoglycemia, that means they have excessive insulin in their system. So what happens is diabetic patients, they need insulin, correct? So they take their usual dose of insulin, but they don't eat breakfast. So for the brain to function, it needs some sort of glucose or sugar, correct? So when they take this insulin, the brain uses that very quickly. So then they become hypoglycemic. Like their insulin levels fall quickly because the brain's already using this up.
Sugar level falls.
Yes. Did that make sense, how I explained it? So normal people, the body adjusts our insulin production and excretion, but in these diabetic patients, they need to take that insulin because their body's not functioning properly. So how do they become hypoglycemic? If they take their usual dose of insulin, but they don't eat breakfast, the brain's gonna use that insulin for the function of the body, but then their storage is gonna be low because the brain's already used it up. They become hypoglycemic. Monty, you look confused.
Maybe we can,
So the brain, in order for the brain to function, it needs glucose.
Yeah.
Right? So if the patient takes the insulin, the brain's gonna use it, right? But then if they don't eat breakfast or something with it, the brain's already used up the storage. So they become hypoglycemic. Basically, like their storage goes down.
storage of sugar goes down. Right?
Correct.
So that's what it is.
Yes, and that leads to insulin shock. So you may see some patients saying like, oh, I haven't eaten all day, I'm diabetic. So nurses would give them some orange juice, crackers, soda, etc.
To try to bring it up.
They just want the orange.
Hi, Mr. Donahue.
Hello. I am here today.
So these are some of the symptoms that they'll exhibit if they're experiencing hypoglycemia. Hungry, weak and shaky, sweating, confused and irritable, and they may also become aggressive and hostile.
So if there was symptoms they'll experience when?
If they're
Oh, okay.
hypoglycemic,
Okay.
these are the symptoms that they'll exhibit.
Hangry.
Angry, yes. Hyperglycemia, that is when there's excessive sugar in the blood, excessive sugar in the blood, and it's a characteristic of diabetes. So these patients, they require insulin, and if left untreated, it may lead to diabetic coma. So hyperglycemia, it develops gradually over a period of hours or days. So as a tech, you may not be able to notice it. But just know that that's the definition for it. And for these patients, you need to give them insulin or it may lead to diabetic coma. Yes.
What is it called whenever like the patient that has like people they have high blood pressure and you have like a device for it like in their skin? What is that called? Is that the same thing as that?
High blood pressure? I know there's
Or-
a sugar monitor that
Okay, is that one? I'm sorry.
yeah, that monitors the levels of their sugar to make
Is
sure.
it like really inside already in their skin, or is it just on the top?
I think it's just a patch that you put on.
It's a little pointy thing at the end, at the back. So you, twist it and there's a little pointy thing and then, you basically poke it up right here on your skin. So it does go,
Oh,
just
it
a little
does go.
portion
Okay,
does go
okay.
in your skin.
I thought it was this.
So the symptoms for hyperglycemia, patients may feel thirsty, may have to use the restroom quite often, dry mucosa in their nose, rapid breathing, drowsiness, and confusion. Respiratory distress, what do you think that means?
Can't control
trouble breathing, your respiratory system is in distress. So there's two things that may contribute to respiratory distress: asthma and choking. And this is a universal sign of choking, right? When someone has two hands on their throat, that's a universal sign. So respiratory distress is caused by air not being able to get to your lungs because the passageway is somehow blocked or obstructed. Asthma attacks, they're triggered by stressful situations. Our job is to remain calm. Make sure the patient's sitting up. If they most of these patients do have inhalers with them, so if they do assist them in finding it. If the patient does not have meds, obviously call for help. And how can we tell if someone is having an asthma attack? Wheezing sound.
Yeah.
So the wheezing sound for asthma attacks is caused by our bronchi dilating and collapsing.
Is that called like hyperventilating, or is that something different?
I don't know if you would call that hyperventilating,
Okay.
because that's strictly caused by asthma.
Okay.
So when they inhale, the bronchi dilates, and then when they exhale, they just completely collapse. Makes that wheezing noise. So that was asthma. Choking, what was the universal sign for choking again? Yep. So some patients with partial obstruction, they may be able to still speak even though they're choking. So you can ask them, are you able to speak? If they're able to, that's partial obstruction. Then complete obstruction is when they can't say anything to you. So just remember those two different types.
They also change color.
Change color.
Like
What do you
their
mean?
like skin complexion, they start to turn
yeah,
blue.
yeah.
Especially babies.
Babies, yeah.
I think like purple or red.
So, yes, if a patient is choking, they should be encouraged to cough because that may help bring whatever is stuck in the throat out. And what do we do when someone is choking? Walk away?
What Another H word, yeah.
Especially if you don't like them.
Oh, you said punch?
Oh, she said.
So,
we need to
yes.
Walk away.
What is this called?
Heimlich maneuver.
Heimlich maneuver, abdominal thrust. So we wrap the arms around the patient's stomach, right? The fist should be around the belly button, and the other one on top. And then the motion that we do is what? Inward and upward.
The for pregnant patients, wasn't it above the?
We're getting there.
Okay.
Hold your horses. If the patient is unconscious from choking, they should be placed supine, and then we should start CPR, because CPR is better at increasing intrathoracic pressure. So that motion is going to help dislodge whatever is stuck in their throat. So yes, CPR is better at increasing intrathoracic pressure more than the Heimlich maneuver. Do you have to stick your fingers in their mouth, or? If you see the object, you can do a finger sweep. If not, don't stick your fingers in their mouth. For a pregnant patient, obviously you're not going to thrust into their stomach, correct? So you would place your arms under their armpits by the breastbone. Okay? For babies, you would hold the babies along your forearm, right? And you would do 1 to 4 back blows on their back in between the scapula, and then 4 chest thrusts using 2 of your fingers on their breastbone or the nipple, in between the nipple line.
Fingers like this or this?
Like this, not like this. So 1 to 4 back blows and 1 to 4 chest compression blows. Cardiac arrest. What is it? That's a definition, sudden stoppage of cardiac output leads to permanent organ damage or death if not treated. And what do we do for patients with cardiac arrest? CPR. Do you guys remember the two different types of AEDs?
One is
Automatic and non-automatic.
Automatic and semi-automatic, and what's the difference between the two?
One does everything for you, and the other one you have to
It tells you.
Correct. Just a little side note, if your brain is deprived of oxygen more than 4 to 6 minutes, it may be permanently damaged. So cerebral function will be completely impaired.
So 4 to 6 minutes?
4 to 6. So CPR, the details of CPR is on these pages. I will go over the details next lecture. But just know that before it used to be called the ABCs of CPR, or airway, breathing, circulation, but it has been replaced by CAB. What do you think that stands for?
Compressions, airway breathing.
Compressions, airway, breathing. So first start your compressions, then check your airway and breathing. And this is the correct rate for CPR, 30 compressions at a rate of 100 to 120 per minute. The use of AED is very important. You have to use it within 5 minutes of cardiac arrest. Very critical. So do you guys remember what ventricular fibrillation is? Yes.
Ventricle quivers.
So fluttering of the ventricles, correct? So if that is ventricular fibrillation, what do you think the defibrillator does? Restores the normal ventricular rhythm, okay? And it's very important that you perform it under 5 minutes or less. It's very critical to survival. And also remember that there's two different types of AEDs.
Reagan had a question.
Oh, yes.
Oh, no, sorry, I was just stretching.
Alright, cerebrovascular accident, also known as CVA. This is commonly referred to as a stroke. And what is a stroke?
It's when you're not, is it when you're not getting enough blood to the brain, or is it?
Yes,
oxygen?
it's basically a brain attack.
Is it caused by embolus or the clots in the brain?
Yes. So warning signs for stroke is paralysis. You know, if you see like the one side of their face is drooping, slurred speech, complete loss of speech, extreme dizziness, loss of vision. One eye may be more severe than the other, and then complete loss of consciousness. And the stroke symptoms may be temporary. Stroke is more likely to occur in patients that are 75 years or older, and the onset of this may be sudden or very gradual.
Just happened at LBJ yesterday.
Stroke?
Mm-hmm.
Oh wow.
It was, I just heard it on the,
Stroke alert?
yeah.
Yeah. Those patients, when they're rushed in through the ambulance, those patients get priority to get scanned. Because if they don't respond quickly, the results will be very severe.
How imperative is time on this one? Because it said cardiac arrest within 5 minutes.
I don't remember off the top of my head what the time is, but do you know what the time requirement is to respond to stroke patients? I forgot the time.
Oh,
It's like
it's
10 minutes, I
Well,
think.
it just does as fast as possible, like immediately.
Yes.
Because within minutes, they can have permanent damage
Yeah.
to the brain.
I
Permanent brain damage?
wanna say 60 seconds. They should be scanned from the time they arrive. They should be like rushed to CT to get scanned.
It's like priority, they will rush them above other patients that they're waiting, it's absolute priority to get them on that scanner as fast as possible.
Yep. Bentob, I know they've gotten several accolades for how fast they respond to strokes, cause they have like papers that they hang up in the shock rooms, and they have a complete list of like what to do, at what times. Alright, now on to minor medical emergencies. We have several of those. Nausea and vomiting. Nausea, we have a psychologic and a physiologic reaction, meaning you can feel that vomiting coming on, right? So that's psychologic, and then physiologic is when you actually throw up. Epistaxis is basically another fancy name for nosebleed. If a patient does have a bleeding nose, they should not be recumbent or head tilted back, because you don't want that blood to go down their throat, okay? And what do? You just give them a moist compress to hold pressure against the nose. Vertigo is dizziness. What does syncope mean?
Fainting.
Fainting. So for syncope, vertigo is often a precursor. So first they feel dizzy, then they faint. Syncope is self-correcting, temporary state of shock. It's caused by a lack of blood flow to the brain, and these patients, they should be laying on their back with the feet elevated, because that improves the blood flow. And putting a wet cloth to the forehead may also help with that feeling of faintness. And then we have seizures, falls, and wounds, which are also minor medical emergencies. So what are seizures, or what happens? It's an unsystemic discharge of neurons of the cerebrum that results in an abrupt alteration in the brain function. So basically your neurons in the brain are misfiring and not functioning properly, leads to someone getting seizures. And we have mild to severe seizures. Mild, these are some of the symptoms that they might exhibit. Brief loss of consciousness. You may see them just staring off into space, slightly confused and weak. Seizure patients, they will experience an aura. So basically it's like a sensation that they're about to get that seizure. It's a physical and mental warning that the seizure is about to happen. So I have a friend that has had seizures for a long time, ever since she was a child, and she will know when it's about to happen, so she'll get herself into like a safe place so she doesn't end up getting hurt.
Does she lay herself down?
Yes.
So like, how does she feel though?
That I don't know. But you know your body best, so if you feel like something's about to happen, you get that gut feeling. Severe seizure is caused by involuntary contraction of muscles. It may last for several minutes. Our goal when a patient is having a severe seizure is to prevent injury to the patient. You may notice that the patient will start drooling, shaking uncontrollably. Do not restrain these patients. Do not try to put your fingers in their mouths, because they will bite you. They will bite off your fingers. So the main thing is to make sure they're safe and away from things that may cause harm.
What does the light have to do with it? Because I know after you get a seizure, you have to they have to be in like a dark room. Kind of?
It may be something with the brain that it affects, like the brightness affects their head somehow. Not sure.
They probably want
Their eyes, I mean.
Would they want to reduce stimulus?
Probably.
Did you try and hold their head up?
Yes, we're about to get to that.
Oh, okay.
So, care of seizure patients. Gently secure the patient to prevent injury. Make sure they're away from, furnitures or objects that might cause them harm. Make sure you put a pillow under their head so they don't hurt their head. Call for assistance. Make sure the patient has privacy, if possible. Do not insert hard objects into the mouth or put your fingers in their mouth. If you're able to, remove their dentures or foreign objects in their mouth, if you're able to. And then observe the patient, make sure they're okay, and then record the time of how long the seizure has been going on. After the seizure is over, place the patient in Sims position. Do you guys remember what that is?
Head up.
Like, what is the sense position?
Head down.
It's a
On
recovery
their
position.
side, with their head off to the side, and that helps them throw up. Because seizures may produce a lot of secretions, so they may need to spit all of that out. And then after the event, make sure the patient's able to breathe. How do we ensure an open airway? Tilt that chin up. Yep. Alright, last one. Or
I'm sorry.
second last one.
Is it possible for a person who's seizing to go into cardiac arrest? Like, how would you do CPR and things of that nature?
Is it possible? It may be possible.
Like, if they've been going through it for a while and they just stop.
Yeah, if they go into cardiac arrest, they're going to stop
Yeah.
the moving.
Mhm.
So yeah, at that point, we may be able to do CPR.
Okay. So that at that point you could do the finger sweep. You could check to see if.
Yes.
Okay. Cool.
Alright. Wounds, hemorrhage, it is basically a bleeding that's happening outside your vessel. So if your veins or arteries are bleeding out, the dressing should not be removed. The pressure can be applied directly on top of the dressing if they have a dressing. And since these are vessels, the clotting may take up to 10 minutes, so pressure needs to be applied for a while for us to be able to stop that bleeding. Once the bleeding is under control, then we can place a bandage over it. Would we ever experience this in X-ray? Probably not. That would be dealt with by a nurse. If the bleeding is happening in an extremity, make sure you raise it above the level of the heart. It decreases the bleeding. If you have patients that have burns, their skin is probably not on, so you need to make sure that you use sterile precautions to avoid infection to the layers of the skin. Wound, how do we say this word? I have no idea.
Dehiscence.
Dehiscence?
Dehiscence.
Okay, so that's when patients that have sutures after surgery, the sutures separate and the contents spill out. That's basically what that means.
Oh, like that elbow you talked about when they were like trying to put it back together and they're just, or was it a kid's hand?
That was a hand.
Hand,
Or
yeah.
foot, I'm sorry.
Foot. Sorry.
And if this happens in patients that have abdomen sutures, the patients should sit up to relieve the pressure off of that wound on the abdomen.
They should sit up even if it's coming out, or the.
Yeah, I mean, you would probably have to lift them up yourself,
Yeah.
but, yeah.
We very rarely would have to deal with all of this. That is the end of chapter 20.
Nice.
What's it called when you gotta like cut off the circulation to an extremity that's been like bleeding out?
Tourniquet.
No, like they take off a belt and they like wrap it around the arm.
Oh.
Tourniquet.
Oh, I thought you said amputate.
Oh.
My fault. I was like, no, that's the opposite.
A
Tourniquet.
tourniquet.